Good morning, everyone. All right. So, the focus I have in the program is in public health nursing, and but excuse me, to try something different out of my comfort zone, I did my practicum at the Ministry of Health in epidemiology and surveillance. And what I was particularly drawn to was the health equity indicators. So, there we go. So then my project focus was in influencing policy decision makers to add more health equity indicators to up and coming policies. And to quote my supervisor, Mike Pennick, we can always use more health equity indicators. So further incorporation of health equity indicators supports health equity initiatives at various levels of governance throughout the province. And these take the focus to the determinants of health. I communicated a selection of relevant health equity indicators to the Ministry of Health in relation to a soon-to-be-released strategy, which I can't talk about. But my strategy was to read up on documents that would support the project goal and to talk to people about how their work influences policy. And one person who had done all this background work on indicators and developing health indicators said her work hadn't influenced policy yet, and I was just thinking in the back of my mind how it was just about to, hopefully, if I could make any impact. So it gave me an insider perspective to talk with Tanis Cheadle, Provincial Manager in Population and Public Health with the Provincial Health Services Authority. And there we go. And my supervisor, who's a population health epidemiologist with the BC Ministry of Health. As part of my method, I identified relevant health equity indicators by reviewing indicators established by provincial stakeholders. And these may be found in the workshop summary, Health Equity Indicators Prioritization Workshop, which is up on the screen there. So these indicators were finalized this past November, and they were designed to be used by the province, health authorities, other stakeholders, and researchers. Quoting from the workshop summary, they were to provide valuable information on the health status of British Columbians across various segments of the population. And so the PHSA also provided the background work for my project, including the literature scan, promoting health equity, choosing appropriate indicators. And the precursor to these documents was towards reducing health inequities, a health system approach to chronic disease prevention. So I didn't have to do a lot of the work, basically. It was already done. It's just a matter of trying to get it applied more quickly. The PHSA is one of the many partners the Ministry of Health works with around health equity measurement and research. And there's a list of some of the other partners here. And so they led the process to establish health equity indicators as an initial step towards developing the targets recommended and towards reducing health inequities. And by applying mutually agreed upon criteria through surveys and a workshop, provincial stakeholders refined a list of 87 possible indicators to a prioritized 51 indicator set. And talking to Tanis Cheadle, she said the process of establishing the indicators was almost as important as identifying the indicators themselves. It took 2 years, and it involved diverse groups across many teams with the regional health authorities, the Ministry of Health, and several PHSA agencies, departments, and programs, and meaningful engagement across agencies and organizations, which each had their own agenda, and priorities made the project a success. So we catalyzed joint solutions was a phrase taken up by group facilitators to describe the process of bringing the group to agreement. So all this talk about health equity indicators, but what is it really when you break it down? What does it represent? It shows the unequal distribution of the health determinant, health status in a population. And it uses the particular cross-cutting dimension measured, and I'll talk about that in a minute. And a health equity indicator identifies social conditions correlated with ill health. So when you break it down to what are you measuring it, it's first you need an indicator of health or modifiable determinant of health. So one example is the infant mortality rate. And next you need an indicator of social position or a cross-cutting dimension, such as income. And so next you need a method to compare the indicator across the cross-cutting dimension, like an income gradient over a number of groups or income gap between two groups, where you calculate the absolute difference between rates or the relative difference, all the fun things we did in our course. So one equity dimension theme is sociodemographic, the sociodemographic theme, and the PHSA group would like to use all of these where applicable and where data exists in this dimension. So age, sex, sexual orientation, ethnicity, Aboriginal status, homelessness, and education, employment, of course income, and then persons below the low income cutoff versus persons above. The aim would be to measure this cross-cutting dimension at the lowest granularity possible. So you want to get it as local as possible when you're going to help a particular community. Though perhaps at the ministry level they would do provincial, and there's strategies in place to try to see how are they going to put this into action, and that was one of the goals in the guiding framework. So that there's a surveillance group working at the Ministry of Health, and then the PHSA is also working on this to get this going. So other dimensions or equity themes are geographic characteristics, neighborhood deprivation, and vulnerable populations. All right. I wasn't sure what time it was. Okay. So health equity is prominent in current policy, locally, internationally, and we see it mentioned a lot in the guiding framework, and that's a visionary document. So we see it mentioned quite a bit, maybe not with the details of what to do, but it's certainly highlighted. My project was about adding health indicators to the strategy that hasn't been released, as I said. So, but I can't go into the specifics, but what I did was added indicators to what they were already talking about in the document itself, because what gets measured tends to get addressed. And monitoring and reporting health inequities is one of the public health's many roles in supporting population health. And the focus is also reflected at a global scale in the Marmot Review. And they highlight the need, the paper from 2010, to incorporate health equity measurements into public and population health policy. So to strengthen the role and impact of ill health prevention to reduce inequalities. In accordance with its role as steward, the Ministry of Health could use these additional health indicators that I suggested to monitor provincial disparities over time. And they do this with some of the indicators they have with the guiding framework. We're just trying to add more. Population health epidemiologists would be able to strengthen the monitoring of inequities throughout the province. And knowing, I can't see that well. Knowing whether inequities are getting better or worse, and in what areas provides an evidence base from which policymakers can adjust policies. For example, if analysts were to take the health equity indicator teen current smoking rate and measure it at the lowest possible granularity geographically, they'd see if their policies are effective based on taking the data right to a specific community. So what are the implications for public health? The data gained from additional health equity measurements would boost the evidence public health decision makers need to make informed health policy decisions, and hopefully this would lead to more reduced health disparities. Statistical analysis of vulnerable population groups articulates evidence from populations that might not otherwise be heard, and without disaggregating the data, we're left with averages that reflect the status quo. So I will just go to conclude here. As Dennis Raphael said, living conditions kill us faster and sicken and kill us faster than lifestyle choices. Additional health equity measurements incorporated into the provincial strategic initiatives would lead to stronger stewardship for program and policy development based on social determinants of health. And was that time? Okay. This is kind of like my eyesight is on an average day, so I don't mind this. Yeah. Thank you very much for listening.
But before we get to Caitlin, questions for Jill? Nobody wants to ask a question? No? All right, thank you, Jill. That was lovely. Perfect timing. Perfect timing.
Oh.